Good morning, good morning, good morning. How is everybody doing? Come on in. Let's talk a little bit. 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 Little bit. All right, guys. Come and let's talk. Come and let's talk. Where are my lovers? Good morning, good morning, good morning. If you're on TikTok, good morning. If you're on, let me put this water bottle to serve as my um whatnot. Let's try go to Facebook. So I've been trying to focus more on myself these days, but this morning I want to talk to somebody that may find this useful. You never know. You just never know. Someone may find it useful. All right. So why did I put the camera on? I put the camera on because um in my experience, right? Anyway, why is the camera on? The camera on. Hi, Tracy. Hi, Simile. Smiley. Hi, everyone. Hi. Good morning. Welcome on board. Help me tap. Help me tap the screen. Thank you. Recently, there have been issues with diagnosing children with bipolar disorder. In my experience, right? In my experience, or at least what I know, what has been documented, is that bipolar does not have to be diagnosed before the age of 17, 20 and stuff. But I'll tell you that is changing recently. That is changing recently. There's a lot of old professionals like psychologists, psychiatrists in the field that are beginning to raise awareness on why bipolar should be diagnosed early or should be looked at. And they are relating it to children with ADHD. And they are talking about the fact that children with ADHD, when they have the hyperactivity, ADHD, the H is hyperactivity, right? They are very energetic. They feel like they can move mountains in the classroom. In the first grade, second grade, they can move these chairs from this angle to that angle. They can cause chaos in the classroom. And if you follow me on Facebook, depending on how long you follow me on Facebook, you will know that I keep saying that mental health is nurtured in this country, especially in the US. I'm a psychiatric nurse practitioner, and based on my experience with the court system, my education, going to the field, working in the jail, working in outpatient, intensive IOP, intensive outpatient rehabilitation programs, and seeing how people are processed back from jail into the system, I will tell you that the problem starts from the foundation. So I appreciate getting to know. I'm doing a lot of I used to, before I was so vested on Facebook with Empower White and mainly Quora topic, whereby I use the art as a case study to educate. This is what I used to do. I always do a lot of continue education things on my own. And I find myself back doing that, and I love it because it makes me to be more vested in knowledge, and it helps me also to align and validate things I have been saying. I always said that mental health is nurtured in children. I always also said that this country, chicken man and eggs. Ooh, okay. Good morning to you, and don't forget to subscribe to my YouTube channel, TikTok. Don't forget to like. Nobody has tapped yet. Just tap your screen. It's free. Tap your screen. Facebook, like the video. Thank you. I cannot align with what this researcher and what this psychologist or psychiatrist was saying. I even requested for the transcript for the what's the name, the master class. I'm hoping that they respond to me and give it to me, because I want to dive more into it and also go and look at the different researches he has described. As parents, as families, as teachers, and as primary care physicians, that is where the problem is. Not primary care physicians, yes, pediatricians. That's where the problem is. When the families start reporting, I always say that your assessment is very important. Why? Because take what's the name? PTSD, for instance. PTSD is the same as acute stress disorder. PTSD is the same as acute stress disorder. The only difference is the duration. How long has the symptom been going on? PTSD, after 30 days of these same symptoms. Acute stress disorder is, let me give you a typical example. As a nurse, you are working, and a patient on the psych ward slammed a door on your finger. Oh, that's pain on your heart. That pain, that pierce inside your heart. Within the first 30 days of having that nightmare and being scared, being terrified, going to the unit and thinking, watching your back, being obsessed with the fact that this could happen to you again, it's called acute stress disorder. You are stressed up about it happening again, the obsession with the thoughts and stuff. However, when this continues and you start the nightmare setting after 30 days, it becomes PTSD. Good morning, Miss Jonah. Good morning. You see that? It becomes PTSD. So I always talk about, if you're a nurse practitioner, pay attention to the domains. Domain 3 is the diagnosis when you are going to take your board exams, right? Okay. So, why am I saying the problem is at the foundation? The problem is at the foundation because as a pediatrician, families start reporting. The schools started picking on the child behavior. They start spoiling the child's record. They start labeling the child IEP. They start picking the child up, profiling the child. Somebody must start assessment. And this researcher is stating that there are things that people should look at and start considering. Greetings from Togo. Ooh, Togo. Good morning, lady. How are you? That's fine. Nyawa, Efonama. Yeah, I went to Ashigame maybe a few times to buy guaranteed Cooper earring, and jewelry to come and sell after high school in Ghana before I traveled. Before I even went to training college and traveled. So I know Ashigame very well. So you know what I'm saying? What they are saying is that when a child, okay, let me go back to the research. What they are saying is that in child and adolescent onset of bipolar, right, you will see symptoms that are very similar to bipolar, to ADHD. I have had somebody who went through trauma. Then they are labeling the child as ADHD person. They are labeling the child with all kinds of things. But when someone goes to trauma, that and the symptoms of ADHD, symptoms of anxiety, they align. They cross. In mental health, all these personalities, some are overlapping the other. So it's important to assess very well. I had to advocate for this child that they have to consider the trauma component. There's a change in the person's living condition, circumstance. There's a change in the people they live with. They are not, the ones they are living with now, they are not familiar with them. That is a stress on its own. So you jumping the hack in the acute phase and diagnosing them with ADHD is not doing the child any service. And research is suggesting the same thing, that the anticonvulsants and the stimulant that are being given to these kids in the name of them having ADHD, which I'm very much against it. I hate prescribing stimulants. If people come to me, I'll give you alternatives, and my alternatives works. They will come and tell me they have improved, but when I want to introduce it, they wouldn't want it. They will be opposing it because all they know in their mind is to get high and be on these drugs. You know, they are saying that when the patient or these children come in, try to consider the assessment. If their irritability is so severe and uncontrollable, know that there will be a mood component in there. When they have they say when they are much irritable, they have much more irritability and frustration. You see a child that is so frustrated, so angered, throw things away, pushes parents. We've seen some on social media, Facebook. Me, I've seen people on Facebook. Hi, the barrier. Let me tell you, I've seen parents on Facebook with kids, little kids, and they will slap the mother. At least 1 or 2 in the past 10 years on social media, or 5 years on social media, Facebook. And I'm like, who? And you sit and watch. And these are African kids that have outbursts. That cannot be ADHD. At this time, you should start diagnosing, doing extensive assessment. Take them to pediatric psychologists, pediatric psychiatrists. Evaluate them effectively. Consider putting them on antipsychotic. Unfortunately, anybody that follows me on Facebook, I will tell you that I am a big advocate against medication. But I also advocate for medication if indicated, if needed. Such an outburst cannot be ADHD. There's an underlying circumstance that needs to be addressed. That mood needs to be controlled. That mood dysregulation needs to be controlled. And that can only be done with medication. So these doctors are suggesting that we use atypical one. They have some that are actually ADHD approved. Lumateperone, Caplyta. You know, the other name is Caplyta. That is one of the drugs. And they said it's good for bipolar 1 and 2. We have lithium. And the thing with lithium is the reason people don't like to prescribe lithium, me personally, the reason I don't prescribe lithium on a daily basis or unless you are already on it is the fact that they need to comply with the labs. They need to come and do their lab work. Lithium has so many things that it can affect you. People on lithium for longevity can cause them to have end-stage renal disease. But research is suggesting now that even the anticonvulsants, the mood stabilizing drugs, they are even more, they are no different. Lithium is much better. There are so many benefits to lithium for both children, and lithium is for what? Batteries. Lithium is for batteries. Yes, you are right. Lithium is actually a drug also. It's a drug that is used for bipolar treatment. It is good for bipolar 1 and bipolar 2. It is good for suicidality. It is good for manic. And it is also good for maintenance. And research is suggesting that it is less used. And I'm telling you some of the reasons why it's less used. Guys, tap the screen, like for me and share. The reason that I don't prescribe it, majority of the reason is the fact that patients in the community will not come and get their labs done. They are thinking of work. They are thinking of other things. So they are non-compliant to the labs. And you need to be monitored. Lithium can affect your thyroid function. People on lithium, most of the time, you see them on what's the name? What's the name of the medication, Miss Aria? Are you there? The replacement, the thyroid replacement, Synthroid. You understand? So you need to check your thyroid panel. You need to check your lithium level. You need to check your renal function, your kidney function. You understand? You need to check, do some labs. You need to check your sodium level. You understand? Centroid, yes. You need to check your sodium level. Lithium affects your sodium level. You need to check your diet. Are you taking sodium diet, or are you taking too much sodium, or are you taking too less sodium? Salt. But lithium is neuroprotective. According to research, they are saying that people that take lithium, bipolar patients that take lithium, they have 10 years. If you are bipolar patient, period, you have 10 years less in your life expectancy. I can explain this. I can take lithium alone and talk about it in a different, but I want to get back to the point. You understand? You have 10 years less, but when you are taking lithium, it reverses that. You are taking lithium. If you have Alzheimer's, you know that your hippocampus is affected. That's the part of the brain that is affected to have Alzheimer's. They are suggesting that if you take lithium, it protects you from losing that capacity. It protects your hippocampus. Lithium protects your memory. You see how it's going to affect you in the long term, preventing you from having dementia or memory loss issues. It helps with neurogenesis. Neurogenesis means to help form more brain tissues. It helps to protect the dura matter, the gray matter and the white matter. You understand? It helps, like I said already, it helps to protect you from frequent manic episodes, frequent depressive episodes. And it's used for maintenance also. So lithium is one of the drugs that has so much benefit. But according to the research, they are saying that because of the risk of kidney issues, people don't like to deter away from it. But they are saying that there is so much research out there that if you read them, it's proven that lithium has proven to be even better. Hi, Miss Kadi. I tried to send you a message on WhatsApp for the book, for Dr. Ramney's book that you want me to get. But the number I had went to someone else. The person responded and told me that it's wrong number. So please reach me out on TikTok, WhatsApp with the link of the book. Thank you. You see what I'm saying? So going back to the story of the children being diagnosed late with bipolar, a child, that's how I described. Oh, and they said they are very hypersexual. So you have a child that is in elementary school, first grade, second grade, third grade, and they have crush on their class teacher, and they want to date their class teacher. Those kind of behaviors, they have that. Their hypersexuality is more evident in that. I would do. Thank you. It's more. Oh, I see. You see what I'm saying? So that is where you have to start looking into these things and start looking and see that this child is just not having ADHD. There is something else going on. But because of the age, they cannot diagnose it at that state. I told you, child and adolescent psychiatry is becoming a thing. It's very profound. I went to what's the name? Johns Hopkins University the other day, and they don't even know, they are complaining, they don't know how to manage those ADHD kids that come with mood outbursts, very bad, throwing things. I went to saw one young guy, very intelligent, and he's caged. And that's the concern for Johns Hopkins. They said that their institution is based on, you have acute situation, you can't solve it, you go back. But here lies the case. The community is now having a lot of these kids that have these disorders. Parents are struggling and they are in the community. What are we doing about it? And my suggestion was the state need to look into it. They need to, even if it's Johns Hopkins or University of Maryland, the institutions have to create a building, a unit for them. But the hospitals don't have it to host these people. So these symptoms start on the foundational level. Nobody is paying attention to it to address it appropriately. Everybody is labeling the case with ADHD, but as life goes on, it turns into something else. Had it been identified and addressed earlier, it could improve the child's quality of life, and research suggests it improves the retention, the ability to stay in school and not be dropouts. When the child have hyperactivity, distractibility, irritability, and is so severe, how would that child stay in chair and be attentive? But when you could control whatever is causing the irritability, that is a mood situation. And the hyperactivity, psychotic medication. It's okay to give children antipsychotic drugs. First generation drugs. It's okay to give it to them, but monitor it. Check the dose and monitor it. You know, so what they are saying is the fact that we are ignoring the symptoms. They don't sleep. In bipolar, you have decreased need for sleep. They feel like they are super energized. They are superman. They are little Jesus. They can move mountains. ADHD kids are doing that, and you are saying they are ADHD. They can do anything in the classroom. They can do anything in the house. They can overcome everybody. Mother don't have power over them. Father can. That is a psychotic problem. That is psychosis. That is not anything related to ADHD. The hyperactivity you are seeing is because there is inability to control their mood and process things efficiently. You get it? So they said that the high comorbidity with ADHD in kids include mood elevation, which I just described just in different terms, decreased need for sleep, much more irritability, and severe frustration, suicidality, and homicidality. You understand? I don't know if these platforms don't like this language I'm using, but we have to, because I'm speaking English. I don't know any other language to speak to describe these things than that. You understand? If there is a family history of bipolar disorder, you understand, and they have hypersexuality, some of these symptoms aligns with bipolar disorder. So if you are seeing these things in children, consider bipolar treatment, mood treatment versus the ADHD. You give them the stimulants, you give them the anticonvulsant treatments, and you have not addressed the psychotic part. This continues, because if you can treat the psychotic and the mood, that helps. That will help to eliminate these symptoms. So I just thought I'd bring that out, and for someone who may need it, you know, so that you are also advocating for your word, because that's what I do. If I advocate for my children, I know better than their teachers. I know better. Well, why do I know better? Because I'm also a little bit knowledgeable in these things, right? I know better because I'm a parent and I know my child. I may know better from a person that has not gone to school to gain the kind of, to be in the kind of career I'm in, which is a plus for my kids, to advocate for them in the right direction. So I'm able to tell an institution, a school, this is what my child needs versus that, right? So I just want you to know you can be an advocate for your child too. You take these symptoms, you're looking at them, what is happening in the home, talk to the doctor. Don't allow the teachers to be the people that will be document, and tarnish your children and act like they are God and they are the determinants of your kids' future. Your job, my mental health is like a raccoon and a mouse had a baby. Well, it's going to get better if you seek knowledge and seek help. Get a therapist or a counselor, a psychiatrist or a mental health specialist, mental health nurse practitioner who can prescribe you something, assess you and prescribe you something. You understand? When the school start reporting, don't agree to it. Take your child, go to your pediatrician, describe the symptoms. Pediatricians are prescribing the stimulants. They are prescribing the mood disorders. But I would say that don't just start with prescription. Diet modification too can help. I have a child that is addicted to sugar. He eats and eats and eats anything sugar. All those things can make them, if in the foundational age, it will make them hyper. So dive into that and change the diet for them. Get them out when they are kids, right? Sometimes they have so much energy. These kids have so much energy. When they close from school, get them out, work them out, get them in like sports, gymnastics, get them on the field, get them in something. Once they use up that energy, that makes them feel obsessed, possessed, like they are super mini Jesuses. And they come back, they eat, they take a shower. You see, they'll be calm. Then now they do homework, they read, they do something. Now the energy they need to get rid of, use up, has been used doing strenuous activities on the field. So when they come to the house now, they are able to focus on things that will give, they need attention, focus, and concentration to do. When the energy is there and it needs to be used, the distractibility and is too much. They are all over the place. They can't focus. Their inattentiveness is too much. So I am a big advocate for non-pharmacological measures. What do I mean by non-pharmacological measures? Non-medication. People, majority of you know what I'm saying. And some of us that are joining from different countries that don't know what I mean, it is doing things that don't involve medication. Getting things like food change, diet change, exercising, scheduling activities around the period of the day where they are highly functional. They just woke up, so they are more relaxed on the weekend. So that moment in the morning is the hours you need to engage them in more mentally tasking, cognitively challenging tasks like homework and studies. Towards the end of the day, they'll be bored, they'll be distracted, they will be more distracted, more stressed. That is when you take them out to use up the energy on the field or do some activity. Then in the evening, after that, they'll be calm down. Again, it helps with sleep, right? I always advocate against sleep medicine if you can. I don't use sleep medicine. I give it, I prescribe it. However, if you can avoid it by replacing that with sleep hygiene, that also helps for some people. Certainly use sleep medicine if you need it. I have people that are so addicted to like Valium to sleep. Yes, it's help with sleep and it is for anti-anxiety. However, these drugs are addictive. And with time also, benzos deplete your memory, especially in the aged population. So why would you want to do that when that is eventually going to affect your hippocampus? Think about it. So yeah, that's why I want to come this morning and tell you a little bit that will help you with advocating for appropriate diagnosis for your kids. And also, at least you know that of all the bipolar medications, regardless of the risk in the side effects, lithium is highly recommended. People on lithium takes a lot of fluid. Sometimes they have to monitor their fluid intake. If you're on psych ward, you see some of the patients, they have fluid restriction. They can take any other fluid, but when it comes to water, they regulate how much water they can have because it affects. Thank you for this educational content. You're welcome. So I thought I'd bring that to your attention. Another drug that they said is for both children and adults. Where did I put that? It's for both children and adults. Of course, I talked about the lithium, but there's another one. Well, when I talk about the medications for treating, I'll come and talk. Oh, here it is. Lorazepam. That one, they said it is used in treating children from 10 years to 17 years that have bipolar disorder. You understand? And of course, Vraylar is for bipolar depression, but it's mainly used in adults. And Vraylar has a lot of metabolic syndrome, this side effect as its side effect. So, but it's really good for bipolar patients that are very suicidal. Vraylar is good for them too. But for the both adults and children, lithium for children and adults, of course, but mainly children 10 to 17 years. The researchers are saying that it's good. Lorazepam is one of those. Okay, so they said use mood stabilizers and use first generation antipsychotics, and the one that is recommended is lorazepam for children. All right, TikTok, I've seen you guys, you refuse to tap, but it's okay. Thanks for watching anyway. Don't forget to subscribe if you can. Facebook, you can subscribe. TikTok, you can subscribe. And YouTube to subscribe. YouTubers, you are lucky. Subscription is free. Facebook, subscribe to support. Thank you, Facebookers, Miss Cardi, all those who have their green badge to date. Guys, I've not been a good girl. I don't come and teach lately. But you guys are holding on to that subscription button. God bless all of you on Facebook. Thank you so much for that. I appreciate you all. TikTok, we have the subscription, but I am not conversant with using TikTok. I don't know how to use the TikTok studio or anything. So the only thing I know how to do is to come on live. Even I don't trust TikTok too, so I've not put in any of my financial information to them. So, but it won't hurt to at least just tap your screen. Just do it. It's free. All right. Hi, Miss Gigi. Good to see you. Yeah. So I'll see you guys again. Okay. I'll see you guys later. Today, I have personal things I need to deal with. So I'm gonna find breakfast. I'm still doing some podcasts. When I finish, I'm gonna find breakfast. I'm gonna bath and I'm gonna get out of the house, and I won't be back till later in the day, maybe 5 o'clock or something. I have a client who want to visit. They paid 2 days ago, but they canceled because they didn't have time. Me too, yesterday I didn't have time. So today, since I'm home this evening, I'll try and meet them. So maybe let's see 7 p.m. I may be back. But if you're on Facebook there, I'm always in and out of Facebook. So as for Facebook there, we live there. We breathe there. So if you haven't followed me on this platform, please do. Facebook, TikTok, YouTube is Epa Worldwide. Instagram is Epa_Worldwide. And don't forget, you can sign up to see me for your individual and family coaching, mental health coaching. If you have a doctor prescribing you something, you want to have a more information, you can send me a DM on Instagram. It's easy to reach me on Instagram. TikTok too. I respond on TikTok too, but Instagram you can see me. Hi, Miss Ari. Goodbye. Have a good day, Miss Ari. We'll talk later. You see? So don't forget to reach out and sign up for your treatment. Guess what? It's cheaper. You go and see your therapist. The therapist will sit down, watch you listen to you, and they leave you to go. When you come to me, you get the tools, you get empowered. You don't live the same. You get the knowledge you need to help you cope. But I give homeworks. You're gonna be practicing those homeworks. Okay. One of my clients said, you are good. So it's left with us now to be doing what you keep telling us to put in practice. Okay. So if you sign up, it's much cheaper. You go to your therapist, $350, $250, and they don't take insurance. That's why I don't do my practice like that anymore. You come to me, you pay cash before I see you. You pay ahead of time. You see the client I'm saying for 3 days now, she wasn't available. I'm not available now. We're both thinking maybe today will work. She paid already. So you send your money. Yes. Because I have to pay my liability insurance and everything. You pay. Good morning, Miss Veron. Good to see you. How are you doing, Miss Veron? It's a minute. Miss Veron follows me way back on Facebook. You can do the same too. So sign up. Thank you so much for liking Miss Veron. God bless you. You can sign up and see me. DM me if you need mental health coaching. DM me if your child is being selected or labeled for disability in the school. I will guide you in the right direction. Hi, Bennett. Speed. Good to see you. Thanks for the like. Make sure you contact me for your services. You will never regret it. I love you guys. I see you later. Bye. Let's end here with TikTok first. Then we end here with